we don't realize we are aging till we get in our 50s and 60s. And sometimes in our 40s, we get worried about aging. And I was born in India, and I grew up in India. And one of the Western serials, TV serials that used to come on when I was a kid was the Lucille Ball show. Here's Lucy. And as I was looking through some quotes to start this talk with, I found this from Lucille Ball. The secret to not aging is to live honestly, eat slowly, and lie about your age. Well, that might help a movie star or a TV star. Rest of us will still keep aging. We could eat slowly, we live honestly, it'll probably help. But lying about the age is not going to help any. And so the point is to age in a healthy way. And how do we do that? The populations all over the world are getting older every day. If you look at the map in 2015, you see there are a few countries that have their populations about 10 to less than 30% of their population, which is older than 60 years of age. But fast forward to 2050, a lot of countries have more than a third of their population, which is over 60. So the world is aging. We are having less children. We are living longer. Why are we aging? And the reason for that is that we are living about 20 years more than our parents' generation did. And so say in 1960, a child that was born in 1960, and if we took the average age of the world, the child had a chance of living up to 52 years of age. In US, it was about, at that point of time, about 66 years. Now, a child that is born today, and we take the average age of the world, they have a chance of living up to 71 years. And a person born in the US has the average chance of living up to 78 years, and most of us are living half of them, us, that get there, are going to be living much, much more than that. We are thinking about people that are centenarians. We all know a few people that are centenarians because we are all living a little bit more. And about 20 years addition to a lifespan of a person means they can do a lot more than they had planned for. Earlier, 60 years, you were just getting done, you had settled your children, and your life was coming to an end. At 20 years, there's chance to travel more. There's chance to look after the family, enjoy the grandchildren a lot longer, maybe even grandchildren's children. And maybe go back to school at a later age, get another degree, get another profession sometimes. I'm a physician, I've worked at 2 of the medical schools which took non-traditional students. And almost all classes had a few students that were over 40 years of age. They already had one career. They were engineers, they were accountants, they were school teachers. They've had one career, and now they've come to become physicians. So many people are doing that. We are working longer. I mean, some of that 20 years we can utilize, because it's a question of you're not done just because you're older. Everybody's aging. Remember, a child born today is also aging. So everybody's aging. Just because you're older, you're not done with life. Many people are working up to 75, 80 years by choice, not because it is necessary. But it all depends on how healthy you are, how productive you can be as you get older, depends on your health. And there's the concept of healthy aging. We cannot, when do we start aging? And what difference does an older age make? So there are certain things which are out of our control, and those are genetic factors. Some of those genetic factors are going to make sure that you get certain chronic diseases because they are tied to your genes. You might get hypertension. You might get diabetes. So those are tied to it. So genetic factors are out of our control. Some of it is controlled by who we are. A man and a woman age differently. Women tend to have a better immune system. Women's bodies tend to weather wear and tear better than men. After all, they've got to produce kids, and there's a lot of wear and tear and pressure on the body that comes when you're pregnant, and every month there's a lot of wear and tear on your body. So if you're a woman, you age differently than a man. Women tend to live longer than men, even as we grow older. And part of it is that composition, who we are, how educated we are. Higher educated people tend to live a longer life. That's a fact of life. When we look at the world population, we are finding out. People that have more money live longer, or at an average, than people who have less money. The kind of occupations you are in. People that are working harder, are doing manual work, tend to live a shorter life as compared to those that are in professions that produce money, highly paid professions. They tend to live longer. So that's what we say when who we are. Where do you live? If you live in a developed country, the environment is less polluted. You age slower. You live in a country where there's a lot of mechanization, there's an unregulated industry. You age faster. That makes a difference. And then finally, your health, not just finally, your health behavior makes a difference. You ate properly, you maintained a good weight all your life, you exercised a lot. Not a lot, even if you exercised a little, it makes a difference. All those factors are going to determine how you age. And that's why everybody ages differently. What kind of healthcare system you had where you were living? You were in a developed country, you had better health care, you had better access to health care, you were richer in a rich country, you had even better access to health care, and that makes a difference as to how you would age. So there's no typical older person. People can be totally different in terms of how old their bodies are at age 40, age 50, age 60. So two people that are the same age can have a totally different body. One person can have the heart and the muscles and the body structure of a 30-year-old at age 60, whereas another person could have the body structure of an 80-year-old at 60. Some of the factors that we talked about will play a role in that. Some of those were under our control, some of those were not under our control. And therein comes, so we are all at 60. Now how do we ensure that going forward from here, what can the society do? What can the community do? What can medicine do for you that you age better? And this is a concept that was developed by World Health Organization. They felt people, even if after 60 they're taken care of, their autonomy is maintained, they are able to live independently, they can live a longer life. And if they have access to preventive health care, you come with certain diseases to that age. They are controlled, but that does not always mean that you are aging healthy just because you don't, your chronic diseases are well controlled. A lot of times, healthy aging is equated to absence of disease or uncontrolled disease. It's really not that. Healthy aging is about making the body wear and tear slow down a little bit, preventing certain things that will induce mortality and morbidity. Now, mortality is where their life is cut short, and morbidity is where a preventable thing causes a disease process. You fall down, you break a leg. That's a preventable thing. If you hadn't fallen down, you wouldn't have broken a leg. So this is Dr. Stultz. He works at the Veterans Administration. He said, disease-specific approach, everybody's following that. Disease-specific approach. Control the diseases people have. Absence of disease or absence of uncontrolled disease is health. No, that's not health. Absence of actually promoting wellness in older age group is actually health. Because the other things have done whatever they needed to do by the age 60. It is beyond that you have to promote wellness. And wellness is not absence of a disease or an uncontrolled disease. So why do we want to do it? I mean, the politicians have to understand it because they're the ones who allocate money. The physicians have to understand it because they are the ones who are to devote time to it. So we need to understand that healthy aging is an investment in the future of the society. We live longer, we spend time with our family, the family is happier, we are able to invest more in our family. That makes the family better. That makes the society better, that makes the community better, that makes the country better, and in the end it makes the world a better place to live. So we need to take care of the older population. We need to help them maintain an independence and autonomy as long as possible. And it is possible if we provide preventative health care, preventative wellness. If we are able to provide that to them, it is going to make a difference. And there are two things. And those two things are really the opposite sides of a coin. We need to have a workforce that is dedicated to older adult wellness. And that's the geriatric health professionals. And we need to have institutions or communities that are ready to invest and work with the older adults to help maintain them wellness. So on one side, there's the health professionals who are invested in bringing health to the older people, and the other side, there's the community and the institutions that are invested in making that happen. So the larger challenge is for these two to meet and work with the older adults in order to bring wellness. So these are some of the barriers that the literature says. Now, what do you think about it? Finance, distance from healthcare, distance from a provider, distance from achieving wellness, some of these things. And then the trained healthcare professionals. Who do you think which of these three do you think would be the biggest barrier? Money, finance. Finance at the institutional level, I guess. At an individual level, also finance could be an issue. Trained healthcare professionals, I do this talk, I ask this question, nobody ever picks up trained healthcare professionals. Although, let me tell you, there is a dearth of geriatric practitioners. Not enough people are going into geriatric practice. Our healthcare professionals, the primary care physicians, the internists that work as hospitalists, do not have enough exposure to geriatric medicine when they are training. So even the ones that are available are poorly trained when they have to look after the wellness, not the absence of disease, not controlling disease, wellness of an older population. They are extremely poorly, not extremely poorly, let me not be an extremist. They do not have enough exposure and knowledge of how to deal with that. And distance, for a lot of people that don't have money, in the end is the biggest factor that prevents getting wellness. They're still able to get health care. If they have diabetes, they're able to get diabetes care. They're able to maintain their disease. However, wellness is the biggest thing that they don't get because of distance. Because as we age, many people are going to get homebound. And if they don't have a social support system, if they don't have a community support system, the distance will become the biggest factor which will prevent wellness. So CMU decided, College of Medicine, CMU, and our dean was especially interested in it. We decided to partner with the Commission on Aging and start a wellness program, which, again, there were two things, right? The trained people and the institution. So institution was the Central Michigan University College of Medicine, and the trained people, we thought how to expand the health professionals pool. Why do students decide not to go into geriatric medicine? They have no exposure. Some of them may have been interested, but they didn't have exposure. And if you don't have exposure, you don't think about it, right? So let's provide them exposure. Use the student workforce to bring wellness into the community. And if it is distance, which is the biggest thing for older adults at an individual level, which is preventing them from getting a wellness checkup, then let's go into their homes and do it. So let's make a home visit program where the students are going into the homes of the adults, older adults, and providing them a wellness checkup. So some of the things, preventable health risks. If you were to look at these three factors, literature says these three factors are the major health preventable things. But which one of these do you think is the most important?
I think isolation and loneliness.
Isolation and loneliness. What would you think? Yeah, actually, isolation and loneliness actually can cause depression. Depression is a risk factor for fall. And once a person falls, the first fall increases the risk for the second fall. And if there is a fall, the chances of something going wrong increase tremendously. So the three are actually very well connected. And yes, it does start with social isolation and loneliness. Social isolation and loneliness is partly also fueled by, because when you age, your sight fails, your hearing fails. And I remember my father, his hearing was failing, he hated using the hearing aid. So what was he doing? He was not meeting his friends as often. And he was isolating himself slowly. So there are a number of things that we don't even think about that matter. Hearing and if somebody has access to health care, these two things can be easily taken care of. And they prevent isolation and loneliness. Your grandchildren kind of lose faith in you. You have to yell to talk to them. They never listen. Sometimes I feel they don't even pay attention to me. Yes, and that kind of fuels into the same cycle of things. To give just one example. So fall is the biggest thing that curtails the amount of life left. So that's why we decided to build this program where we'll take the students, a faculty physician will go with the students, and not just that. It's not just the medical students that need to be exposed. It is all the health professions. It's the PA students, it's the physical education students, it's the athletic training students, it's the social worker that has to deal with the wellness of the community. It's the audiology students, it's the speech and language therapy students, it's the nursing students, it's the pharmacist. Everybody needs to get that exposure. So we decided to create a team of students which was interprofessional. So there's one medical student and there's another health professional that goes with them and a social worker because that's their job. They are the ones that work in the community and are the conduit between the patient and the health professionals. So why not give all these students that training under the supervision of a faculty where they're investing and they're getting trained by the older adults or the seniors in the community? Why not tell them that they are helping the students get trained and at the same time they're reaping a benefit by the students visiting them? So we thought it would be a great thing for our students. Our needs to train our students are getting fulfilled by that, by getting help from the community. And yes, it's a win-win situation for both sides. Some of the loneliness, one of the things that I saw when I went out recruiting people to join this program, some of the people that lived alone, they sat and talked to me. So the students that had gone with me, I could see them suddenly realizing that this is probably the only human contact this person has had in a little bit of a time. And that's why we needed to sit down, we needed to listen to them. And we needed to listen, and they learned that this is not just because we've come to recruit. It will also happen when somebody comes to visit them in their offices. And some of the students actually commented about that. They said, one of the things my grandma always complains is the doctor doesn't listen to me.
Yes.
I have a story to tell, the doctor has no time. And suddenly, these are second-year medical students. They're learning that. And some of them, it is going to shape them into better primary care physicians because they are learning here to sit down and listen. So it's a win-win situation on both sides. And finally, this is what I want to say, that investing in healthy aging like this, and this would be, if it's an ongoing program, we are able to do a wellness visit, we are able to do certain things where we check if somebody has a risk for fall, and we are able to prevent it. Because CMU has the resources at the back end if the client does not. If the person we are visiting does not, then CMU has the resources to put into that situation. And those that have their own resources, they also find out beforehand, before they fall, that there was a risk for a fall. They find out about the wellness part a lot before things go wrong. And that prevents not being well. Let me put it this way. So these are our M2 students that would be visiting in the coming session. This is their white coat ceremony. So at the beginning of their year, when they come in, there's a white coat ceremony where the white coat, they kind of are given the white coat by some of the faculty members. And then after that, they're reading the oath, Hippocratic oath, that they would follow it and do a good job. And that's our dean, who is really invested in it. And in fact, he is going to be out on these visits with the students. He's promised me that. And finally, we wrote a grant for it. And from Michigan Health Endowment Fund, we needed funds to start the project. So Michigan Health Endowment Fund gave us a very generous grant of $422,000 to start the project. And so we think for 2 years, if we run the project, we would be able to, beyond that, we would be able to generate money out of the Medicaid, Medicare, because the physicians are home visits by the physicians, and we would be able to continue the program as a curricular thing where we are educating the students and working with the community to increase the wellness of the older adults that are living in the community.